Thank you, Dr. Wee. She's standing in our office after acquiring $80,000 of school loans. She has disqualified herself from our program. Why? Not because she did not know how to do an inferior glide of the glenohumeral joint, but because she refused to accept critical feedback from her clinical instructor. This scenario, stumbling onto the term professional identity formation as opposed to professionalism, and asking the question, what does our program exist to do, is what inspired my dissertation at USC and our program's Professional Identity Initiative. So I have two things to share with you today. First, highlights from my research regarding factors our students perceive to influence their professional identity and how that impacts them, and our program's initiative to support professional identity formation based on this and other salient research. Professional identity formation is defined as the internalization of values, attitudes, and conduct within a specific profession and the perception of oneself within that professional role. Leaders in healthcare education reform advocate for including it as an explicit educational objective. This is critical because a strong professional identity is associated with increased compassion, resilience, educational persistence, and decreased burnout. It is also correlated with increased job satisfaction, successful student transition to the clinic, and critically improved patient care. Because professional identity is a process that develops through active engagement, self-reflection, assessment, role modeling, and feedback, educational programs like ours play a pivotal role. It has not been made a priority in physical therapy education, despite the fact that the American Physical Therapy Association promoted it as a component of academic excellence. A gap has existed in understanding physical therapy student professional identity development, particularly during didactic curricula, and understanding the student perspective. So to fill this gap, a mixed methods study design was implemented using anonymous student surveys with both open and closed-ended questions to gather quantitative and qualitative data. Here you can see that the 3 cohorts that had spent more time in the program were included. I can share with you more specifics regarding methodology if you're interested. And first, the quantitative results. You can see the assumed factors based on research impacting students on the left side of the slide. Between 80 and 95% of respondents agreed or strongly agreed that each factor, faculty behavior, faculty feedback, peer behavior, self-reflection, and formal self-assessment impacted their development while on campus. These findings indicate that physical therapy students' perceptions align with previous studies in other healthcare fields, such as medicine, nursing, and pharmacy. This was noteworthy, suggesting that existing frameworks for supporting student professional identity in other healthcare fields are applicable to physical therapy education as well. Faculty behavior and feedback were perceived by students to most strongly impact professional development. Spearman correlations were also computed to determine relationships between cohort and student perceived factors. No significant correlations between cohort and any survey questions were found. Qualitative student responses led to deeper and a richer understanding of on-campus experiences that supported or undermined student professional identity development, and then how these experiences impacted students. Open coding was applied to these responses to visualize patterns and to generate themes. I don't think this is advancing. Oh, perfect. The open-ended question, what are or were the 2 most important factors facilitating your professional identity development while on campus, was asked. Student responses represented both internal and external influences. 48 of those responses were linked to faculty. Students noted the importance of faculty influence in a variety of capacities. The most frequent code relating to faculty influence was feedback. A student stated, I feel that personal feedback from teachers is rare. I don't necessarily think that this is fault of faculty. Rather, I need to seek out those conversations more. However, when I do get that feedback, I feel is very helpful and allows room for growth. Connection with faculty and one-on-one conversations along with time outside the classroom was a sub-theme repeatedly mentioned pertaining to faculty influence. Students noted that individual meetings with faculty, opportunities to discuss, and impromptu conversations with professors were meaningful. Faculty influence went beyond feedback, and students noted that role modeling, observation, and behavior of faculty also impacted them. One student stated that faculty gave them an honest example to follow. Additionally, students perceived the impact of firsthand experiences shared by faculty as influential. One student stated, hearing about faculty experiences, especially when they made mistakes and how they grew from them, was a powerful influence. Programmatic elements were also noted to influence development. One specific course, Whole Person Care, was mentioned. This course emphasizes the biopsychosocial spiritual model of healthcare and wholeness of both the provider and the patient. A student shared, I was heavily influenced by our education on whole person care. I feel that whole person care has been the most important topic for me and has influenced how I desire to strive and develop rapport and connect with my patients. 13 responses pertained to self as a primary influencer. This aligns with the understanding that professional identity includes internal factors which impact the identity development process. Within this theme, most responses were linked to self-reflection, their own personal perceptions and effort, and one response was linked to faith. Ultimately, students perceived external factors to be more influential than internal factors. An additional open-ended question asked students the following. Describe an experience during your time on campus, if any, that positively impacted your professional identity, followed by how did that impact you? Results were anchored in one overarching theme, what faculty gave. This theme included 5 domains of giving by faculty. Faculty gave time, faculty gave grace, vulnerability, authentic learning experiences, and inspiration through role modeling. Within this primary theme of what faculty gave, a sub-theme that emerged was the time that faculty offered students through one-on-one conversations and connection. Students reflected this gift of time, stating, I discussed with the professor and they told me the strengths they saw in me that they thought would allow me to thrive in that setting. Another student reported, talking with a professor during any period of time, especially difficult ones, was always a conversation that positively impacted me and inspired me to be like her. Students perceived that faculty extended grace through compassion, encouragement, and opportunities to learn from failure. Verbatim quotes included, faculty understanding of emergency situations outside of school, and I realized that sometimes failures are to happen to help you grow, to help you be a better professional, and to learn to be successful in the future. One student described doing poorly on an exam, stating, one time I completely bombed a final exam when I nearly aced the midterm of this class. I was really down on myself, but my professor emailed me and sent me a message of encouragement, stating, this was just an outlier exam. It doesn't define my ability to be a great therapist. Students perceive the gift of compassion from faculty as supportive and meaningful for professional identity development. Beyond time and grace, students recognize that faculty vulnerability helped them see who they were or wanted to become. Faculty sharing personal experiences with patient care impacted students. A student reported multiple times professors would explain a situation or experience they have had that impacted them, which shed light on my own views, impacting my own values and my professional identity. Students noted inspiration through role modeling by professors as a powerful guide. One student stated, I love seeing patient models and how our professors interact with them. It brings to light their love for the field and how I want to be able to communicate with patients and impact their journey. How these positive experiences impacted students was reflected in 3 primary themes: thinking, feeling, and future action. For example, one student felt acknowledged, stating, it allows me to feel recognized as a person with goals and aspirations. And another stated, it helped me envision what my future profession would look like and my future self. Notably, this change in thinking, feeling, and future behavior distinctly correlates with Merton's defining goals of medical education to think, act, and feel like a physician, which are the defining concepts of professional identity formation. I also wanted to understand what experiences threaten identity development, and I asked students, describe an experience during your time on campus that, if any, negatively impacted your professional identity, followed by how did that impact you? The themes of faculty, COVID-19, and self as perceived barriers to professional identity development emerged. Interestingly, more students perceive themselves as an internal influence to be the primary barrier to their own identity development. Students felt that COVID-19 deprived them of positive experiences with faculty, yet on the other hand, when students had poor interactions with faculty, they felt that it was a threat to their professional identity development. The result of these experiences on campus, which students perceived to undermine professional identity development, impacted student health, but primarily student self-efficacy. Feelings of uncertainty, discouragement, and inadequacy resulted. A student reported, "This led to feelings of doubt and uncertainty and made me wonder if I was in the correct field of study." Beyond questioning themselves, one student described when a faculty member allowed them to pass a lab practical when they actually should not have passed, leading the student to question the entire profession, stating, "It called me into question the expectations that should be required as a future member of the doctoring profession." Ultimately, the relationships with and behavior of faculty influenced students' internalization of values, motivation, envisioning of their future selves and their roles. Faculty were perceived by students as the key driver of professional identity development during didactic curricula. So how are these results impacting our program? In alignment with Hafferty, I would offer that a professional presence is best grounded in what one is rather than what one does. In the past, we've been focused primarily on the doing of physical therapy rather than the being. Understanding the student voice bridges the gap from theory to practice in physical therapy education and really has driven a call to action. We have established a professional identity initiative in our program to meet both healthcare education and American Physical Therapy Association recommendations. Can you advance this slide for me? Perfect, thank you. 3 components are being implemented to embed professional identity formation into our program. First, a professional development alert, which includes formal identification, documentation, and follow-through regarding concerns. The second component is faculty development. Faculty uncertainty regarding professional identity formation is noted in literature. Consequently, emphasis on faculty knowledge and development has been prioritized regarding the process and the magnitude of faculty role. And third is creating an explicit curricular thread. Students require an intentional framework of support for professional identity development. It must be explicit and longitudinal throughout a program. We have developed a professional identity thread, which will be initiated this summer with our new cohort. And finally, I will introduce the components of our curricular thread. Professional identity formation will be introduced during orientation, and we are planning on making it a formal program objective. A new course, Professional Formation, will be comprised of 2 one-hour courses that are threaded throughout didactic curricula. It is considered an invitation for students to participate actively and intentionally in their own process of becoming, and for them to exert conscious and thoughtful agency over their own transformation. Each course will have 5 two-hour sessions for 10 contact hours each year with required attendance and pass-fail grading. The student will have a portfolio that includes self-assessments to track progress and growth. This will highlight professional identity as a process with emphasis on growth through reflection. We assess what we value. That is why students will complete the McLeod-Clark Professional Identity Scale and the Professional Behaviors Assessment yearly. You can see additional topics covered listed for each course. And the intent is to empower students to engage in the lifelong process of professional identity formation as a goal of their education. In conclusion, we are beginning with the end in mind. Explicit professional identity development aligns with our motto, not just for patient wholeness, but to support wholeness in our students. Education is transformational. We are in the business of transformation. As educators, we have likely underestimated our critical role in this process. May our students embrace the value that the most important thing we give our patients is ourselves. It is not just what we do, but who we are. Thank you.
Wow, thank you for that. Thank you for that. I want to invite those who may have questions for Dr. Gang to please come to the microphones. I guess one question that came up when I was listening to your presentation is how did just the realization of how important a faculty member can be to a student's professional identity formation, how did that impact your practice personally?
It's kind of a full circle moment, because as an educator, sometimes you wonder, did they hear what I was saying, or did they think what I'm saying is valuable? And actually, it's become even more value to me in my role, understanding my role, and that you can get so much content. We're overloaded with content. Content's everywhere. But they're really looking at human beings, how I live, how I act, how I treat my patients, how I treat others around me as an influence. And it is a profound role modeling that we have and responsibility that we have. So it actually has inspired me. And I'm trying to even further take the opportunity to spend more time with students outside the classroom, which actually is energizing. It doesn't deplete me of energy, but actually increases my energy level.
I love that. While we're moving in through the age of hybrid education, how do you think that's going to change the program maybe in the future? So much of what the students reported was that one-on-one interaction being incredibly important.
And that's not going to happen on Zoom. It just won't. You can exit the room and have a private conversation on a computer, but it's not the same. So we actually brought that up in a faculty meeting when I presented these results to faculty, because the big push is do more online, or maybe we could have a hybrid program where sometimes they're on campus and sometimes they're not. And I really think in the big picture, we're robbing students of the opportunity of the really depth and that transformation. And this is obviously studied here on Loma Linda campus, which is different than maybe other campuses in the sense that we have close connections with our students. And on exit interviews, our students say, hands down, every single year, the most important thing for them was their relationship with their faculty while they were here on campus. We know that clinicians, when they go in clinical education, are profoundly impactful, but that's one of the reasons why I wanted to study just what happens when they're here on campus and where do they find that value. So that's going to be an interesting dilemma that we're going to look forward to navigating in the future. But for now, we have some good things in place to try to promote this.
I love that. Thank you. Questions from our audience? I heard something. If you have a question, I just want to invite you to come down to the microphone so it can capture that. I think one of the other really striking elements was the act of grace and compassion that was really mentioned over and over again. I'm wondering whether there's, it brings to mind that physical therapy is it's a very close proximity interaction. So, for example, as a physician, I may spend a little bit of time examining my patient, but I also may spend more time being separated from my patient by a buffer. But it seems that physical therapy, actually, you are in close proximity or touching your patient for longer.
For sure, and I think because of that, one of the things, you heard my interest in Therapeutic Alliance, and that's the ability to create that connection with the patient, how important that is. That's important for all healthcare providers. I think we've even taken that concept of Therapeutic Alliance and it can be transposed into our relationships with our students and how important it is to know their story. We have students who have family members who have never gone to college. They're going to college for the first time, don't have anybody enforcing, hey, these are good study habits or these are good decisions to make as you're in grad school. And so we've really, I think, opening our eyes to that connection that we have with students in order for them to help create that with their patients is going to be really important that we model that.
I love that. You know, this is, I think, one of the lovely things about having an interdisciplinary campus, is that we can learn from each other and to be able to glean insights from other disciplines. So thank you so much for your work today. Let's give Dr. Gang oh, sorry, we have one, before we have one question here.
Some time ago, I had a unique opportunity to review the performance of residents who attended lecture compared to those who were at remote location could not attend the lectures. And to my amazement and chagrin, those who did not attend the lectures actually performed better on this test that they took as a group. And I think that goes a long way in saying that content you can get by reading or watching a lecture or some other way, but it's the role modeling that we are primarily transferring in audience situations or on one-to-one.
For sure, great comment, and I don't take it lightly that my identity as a Christian is my most foremost identity, and I want that displayed in my teaching and my interactions with my patients as a role model for students as well.
Thank you so much. Let's give Dr. Gang a hand.